Good afternoon, everyone. The topic for today's discussion is heavy menstrual bleeding and bleeding disorders. I am Dr. Lakshmi Srivaths, Professor in the Department of Pediatrics, Section of Hematology at Texas Children's Hospital, Baylor College of Medicine. I will be doing this presentation with my partner, Dr. Jennifer Dietrich.
Good afternoon, everybody. I'm Dr. Jennifer Dietrich. I'm also a professor in the Division of Pediatric and Adolescent Gynecology and the Department of Obstetrics and Gynecology, and I'm happy to be doing this presentation today with my colleague.
Thank you, Jennifer. Together, we both are partners in our Young Women's Hemostasis and Thrombosis program. The outline for today's talk is as follows. We'll first take a look at the definition and causes of heavy menstrual bleeding, and then we'll look at the various bleeding disorders that can present as heavy menstrual bleeding and look at their manifestations and complications. We'll also look into the evaluation and management of patients with heavy menstrual bleeding and underlying bleeding disorders, and then we'll see what questions you as a patient need to ask your healthcare provider about heavy menstrual bleeding, and when and how to get referral to see specialists for heavy menstrual bleeding and bleeding disorders management. So let's first take a look at what exactly is heavy menstrual bleeding. Heavy menstrual bleeding is defined as when during your menstrual cycle you soak through one pad or tampon every hour, and if your menstrual cycle is lasting for more than 7 days, which will then be equivalent to a blood loss of more than 80 ml, that is more than half a cup of blood loss. So is heavy menstrual bleeding really a problem? Because oftentimes patients come to us saying that they have heavy menses, their mother, their grandmother, their maternal aunts, a lot of their family members have heavy menstrual bleeding, so it actually just runs in their family, and so they think it is normal. So is heavy menstrual bleeding a problem? Yes, it is. And why is that so? Because heavy menstrual bleeding can lead to you as a patient feeling very tired that you're not able to participate in your schoolwork or complete other activities like sports related activities or even participate in social activities. It can lead to low blood counts, otherwise called anemia. When there is excessive blood loss, it can lead to low blood pressure that you could even faint. And when it is very severe, it can cause heart failure. And overall, all these signs and symptoms can lead to poor quality of life that you are not able to participate in your day-to-day activities, unable to function effectively. So what are all the various causes that can lead to heavy menstrual bleeding? As a teenager, going through normal puberty in itself can have hormonal imbalances that can lead to irregular cycles and heavy menses. But based on our experience, we know that about 25 to 30% of the patients can actually have an underlying bleeding disorder as the cause for heavy menses. In fact, heavy menstrual bleeding is the most common presentation of many of the bleeding disorders in females. Pelvic infection and other hormonal imbalances like thyroid abnormalities can cause heavy menses. An abnormal uterine shape or abnormalities of the ovary like cysts or tumor can also cause heavy menses. And pregnancy related issues can lead to heavy menstrual bleeding as well. So when the patient comes to us with heavy menstrual bleeding, let's take a look at how we quantify their menstrual bleeding to give them a diagnosis of heavy menstrual bleeding. So we use the pictorial blood assessment chart that is illustrated here, and oftentimes we will ask the patient to give us information about their previous cycle, and based on that we'll score this chart. And sometimes we will give this to you as a patient to take home and then to chart it during your next menstrual cycle and bring it back to the clinic so we can then score the menstrual bleeding that you have actively scored as you had your menstrual cycle. So it is important for you to also understand what exactly this chart means. So I'm going to go through this chart quickly here. On the left side, we have pads and tampons that are variably stained, and each one gets a different score. For example, the lightly stained pad gets a score of 1, a moderately stained pad gets a score of 5, and a fully soaked pad gets a score of 20. Likewise, for tampons, the score is 1, 5 and 10 respectively. Also, if you are having clots, if you are passing tiny clots, you get a score of 1, and if you are passing clots that are quarter sized or larger, then that gets a score of 5. And if you're flooding, that is if you're staining your clothes, that gets a score of 5. So as an example here, this patient Jane Doe on day 1 used 2 pads that were only lightly stained. So that gives a score of 2 times 1, that is 2. Whereas on day 4, the patient used 2 pads that are moderately stained and 2 tampons that are also moderately stained. So that gives a score of 2 times 5, that is 10, and another 2 times 5, that is 10. So total score of 20 for this day 4. So likewise, the entire menstrual cycle is scored, and then all the scores are added up to give a summative score here. So if the summative score is more than 100, then that is equivalent to heavy menstrual bleeding. What are all the various bleeding disorders that can cause heavy menstrual bleeding? The first and foremost is a condition called von Willebrand disease. This is relatively commonly prevalent in the community. In fact, this is the most common inherited bleeding disorder, and as I mentioned before, in females, the most common presentation of this disease is heavy menstrual bleeding. In addition, platelets are cells that are present in your blood that help to form the initial clot. So if the platelet is low in number, which is otherwise called thrombocytopenia, or if the platelets are not functioning well, which is called platelet dysfunction, they both can lead to heavy menstrual bleeding. In addition, you have several clotting factors in your blood that are important to stabilize the clot. And if these are also affected, then that can lead to heavy menstrual bleeding. Rarely, even if your clot forms well, your clot may break down too quickly, and these disorders are called fibrinolytic pathway defects, which can also present as heavy menstrual bleeding. So when you come to us with heavy menstrual bleeding and we diagnose bleeding disorder as a cause for the heavy menses, what does that mean to you? So when you have a bleeding disorder, it means that your blood does not clot well. Like I mentioned, platelets, and there are several clotting factors or proteins in your blood that get activated when there is a need to clot during trauma or surgery or procedures or some other hemostatic challenge, including your menstrual cycle. And these platelets and blood clotting proteins become very important elements for the blood to clot. So if these are either low in number or if they are not functioning well, then your blood just takes too long to clot, and as a result you just continue to bleed and lose a lot of blood. So I mentioned that heavy menstrual bleeding is a very common manifestation of patients with underlying bleeding disorders in females. What other problems can they present with? Patients often come to us with frequent nosebleeds, gum bleeding, especially when they are brushing their teeth in the morning. They have easy bruising in response to even minor trauma like bumping themselves against a hard object, and they can have prolonged bleeding from minor cuts or any other major wounds or trauma situation. They can have bleeding after dental procedures. This is a very common presentation. This can happen after tooth extraction, or they can have swelling, which is called a hematoma, after an injection of a local anesthetic into the gums. Prolonged bleeding and severe bleeding can happen after surgery, and that will depend on the severity or the extent of the surgery. Bleeding can happen during and after pregnancy. Patients can also bleed into an ovarian cyst, and this can rupture, resulting in blood entering into the abdominal cavity, which can be a pretty serious complication. At this point, I'm going to request my partner, Dr. Jennifer Dietrich, to continue with the talk. Jennifer.
All right, so thank you, Dr. Srivaths. So I want to go into a few specific concerns that we have within patients who have bleeding concerns, bleeding tendencies, and ultimately may have an underlying bleeding disorder. And so there are a number of gynecologic and obstetric complications that can occur, and some of these include the following. So a bleeding ovarian cyst, which is known as a hemorrhagic ovarian cyst. Endometriosis, which is when the lining, the cells of the uterine lining find themselves outside the uterine cavity. And so in addition to a woman having a menstrual cycle, shedding that lining, these cells actually bleed into the abdominal cavity. And if you can kind of see here, there is evidence of these cells implanting themselves outside of the uterus. So it can be associated with the intestine, the bladder. Adhesions can form between these structures. Some of these cells can implant themselves on the ovary or on the fallopian tubes. And so not only are these patients bleeding with their menses, but the cells are bleeding within their abdominal cavity, and every time they bleed, not only do they cause problems such as adhesions, but they also cause pelvic pain. In addition, sometimes these individuals are going to have bleeding during pregnancy, and that becomes very important for the future because these women are going to need access to a high-risk obstetrician. And then certainly bleeding after delivery, which we term a postpartum hemorrhage. So you have to be asking the question, well then how do I get tested if I have some of these symptoms? Well, the initial testing will frequently be done by your primary care provider. And this might involve checking things like blood counts or your iron levels. Additional testing may be further performed by a pediatric hematologist or pediatric gynecologist. And this is really to find out if there could be a common bleeding disorder, such as von Willebrand disease. If there are additional tests that are needed because it's not clear what the underlying bleeding tendency might be, this additional testing is best performed by a pediatric hematologist. And this is really to kind of focus on the more rare bleeding disorders for which specialized tests are needed. So some of the treatments, let's go into this in a little bit of detail. I mean, the first focus is that we really want to control the bleeding, okay? So bleeding control can be managed with a variety of different agents that are clot strengthening, number one, or it might be clotting factor replacement, okay? So some of these include things like aminocaproic acid or tranexamic acid. These really work on a certain pathway that helps stabilize a clot and prevents it from dissolving so quickly. The factor replacement category really involves replacing certain factors that might be deficient. And so there are a variety of different options, including even the replacement of fresh frozen plasma or platelets. So this is through a transfusion. In the category of hormonal treatments, this is typically a first line for many women for whom we are either doing a workup to understand what the underlying bleeding disorder might be and control their heavy menstrual cycle, or perhaps they already have a diagnosis. Either way, we utilize very similar hormonal treatments. And so for women who are actually candidates for combined hormonal methods, we have things in pill form, patch form, and even in ring form. For women who are not candidates for estrogen options, we have many different progesterone-only options, and these include things like an IUD, which is an intrauterine device, an implant, which contains only progesterone, an injection, and even pills. And then finally, we can't forget that we want to address anemia. So for the individual who has really focused on therapy, that's one thing. But for the individual who has not yet started therapy, sometimes anemia is a primary concern in the beginning. And so it's very important for these women to actually start iron therapy. That can be delivered orally or actually intravenously. And then finally, some women, if they have really severe anemia, resulting in symptoms where perhaps their heart rate is beating really fast, or there might be a concern that they are having dizziness or other fatigue symptoms, they might need a red blood cell transfusion. So there's some really important questions to ask your health care provider, and I would encourage you to write these down. So is the amount of menstrual bleeding I am experiencing abnormal? What tests do you need to do to diagnose the cause for heavy menstrual bleeding? What are the complications of my heavy bleeding and how can I avoid it? What is the best treatment option for my condition? And finally, what are the disadvantages and risks associated with each recommended treatment? So we wanted to address some frequently asked questions and also answer these while you have expertise available to you because these are common questions that come up. So if I have a bleeding disorder, what precautions should I take to avoid excessive bleeding?
So as a hematologist, we will recommend several lifestyle modifications that are very important for you to follow in order to prevent excessive bleeding and to have a near normal life.
Okay. Are there certain medications that I should not take?
Yes. We will recommend that you not take certain medications including aspirin, ibuprofen, Motrin, naproxen, etc. These are typically taken for controlling pain, but these medications also affect platelet function, and so they'll put you at a higher risk for bleeding. So we will recommend that you not take these non-steroidal anti-inflammatory drugs, as they are called. Instead, if you have pain or fever, you can take acetaminophen or Tylenol. There are some other medications also that can affect platelet function. Talk to your treating hematologist, tell them that you have a bleeding disorder, and ask them if a certain medication is appropriate for you to take.
Okay. What do I need to do before surgery or a procedure if I have a bleeding disorder?
If you have a bleeding disorder, it is very important for you to inform your treating hematologist that you are going to have a surgery or a procedure well ahead of time, at least 1 to 2 weeks ahead of time. Why is that so? Oftentimes we may have to do some additional blood tests to confirm your diagnosis. There is also something called a clearance study that we often do to find out how quickly you would clear a certain factor that can be used as a treatment for you. And based on all this information, we will then work out a treatment protocol for you, wherein you can start taking some medications before the surgery or the procedure, and then continue that for several days after the procedure, by which you can significantly minimize the blood loss because of the surgery. So it's very important for you to let us know that you're going to have a scheduled surgery or procedure.
Are there other special precautions that I should take?
Absolutely. If you have a bleeding disorder diagnosis, it is important for you to wear a medi-colored bracelet or a necklace that will have your diagnosis and also the type of treatment that is that can be given to you. This is very important because in an emergency situation, when you have sustained a major trauma, it is important for the treating physician to know what bleeding disorder you have and how you should be treated in order to prevent excessive blood loss.
Okay. Are there any activity restrictions?
Yes, we will advise that you avoid activities that cause trauma. For example, we do not want you to be jumping on a trampoline because you can fall and hit your head, and that can lead to bleeding inside the head, which can be life-threatening. If you want to ride a bike, we advise that you wear a helmet to prevent any head injuries. Also, diving is not acceptable, but swimming will be okay. We also typically recommend that you avoid high impact contact sports where you can be subject to injuries and can have bleeding or hematoma formation. But as a teenager, it is very important for you to participate in sports to maintain an active, healthy life. But there are a variety of other sports activities that are not considered high impact contact sports, and your hematologist will be able to help you in selecting the right sport activity.
Great. Is this heavy bleeding affecting my iron levels? And if so, what can I do about this?
Yes, when you have continued blood loss, you are losing iron through the blood cells, and so certainly you can become iron deficient, and that can explain the fatigue and the tiredness that you're experiencing. And it's important to correct the iron deficiency. The iron deficiency, when it is very severe, can manifest as anemia when you look pale as well. But of course, there are females without anemia who may still have iron deficiency, and many studies have shown that this can actually have a negative impact on their learning ability, on how well they function at work, etc. So it is very important to correct your anemia and your iron deficiency. If you talk to your hematologist, then we will be able to prescribe the right kind of iron medication. When it is very severe, when you are not able to take medications by mouth, we can even give it intravenously. And of course, when you are experiencing severe menstrual blood loss and your hemoglobin is very low, that you are severely anemic, then we can even give you a blood transfusion. The other questions can include, can I get pregnant?
So yes, it's absolutely possible for women with a diagnosed bleeding disorder to get pregnant. This can happen spontaneously or even with the assistance of reproductive technologies. However, with the assistance of reproductive technologies, frequently there are minor procedures involved, and therefore it's going to be advised that you communicate with your hematologist in order to have these procedures done safely without a bleeding complication.
So you talked about a bleeding cyst, so will I need surgery for a bleeding cyst?
So it varies a little bit when people have a bleeding cyst or a hemorrhagic ovarian cyst. For someone who has a hemorrhagic ovarian cyst that is stable on ultrasound, and we can see evidence of that based on blood counts that are also stable, we don't necessarily need to operate. The body actually will take care of this type of cyst spontaneously, okay? And usually we'll do a follow-up ultrasound in 4 to 6 weeks. However, we get most concerned for the individual who has a bleeding type of cyst and it continues to expand. And so that bleeding pocket contained within that cyst, the more it expands, the more we get worried. And certainly when that correlates with a drop in blood counts, there is frequently a need to intervene surgically. And we can do that in a minimally invasive fashion in most cases, and sort of stop the bleeding by coagulating the spot that started in the first place. And then we can plan from the future. So sometimes when this type of a bleeding cyst occurs, it is a sign that someone has an underlying bleeding disorder. But for someone who already has a known bleeding disorder, we already know that they're at risk. And so making sure that we are adding the right replacement hemostatic factors can also help us stabilize that cyst.
How can I avoid having a uterine procedure?
Yeah, well, I mean, first of all, in adolescence, we try to avoid doing anything invasive in the uterus, okay? Especially if someone has a bleeding disorder, stirring up any type of mucosal bleeding may result in more bleeding. And so we really try to avoid doing anything permanent. However, occasionally, when we have maximized our medical therapies, we can use a little balloon inside the uterus. It's not delivering any type of thermal energy in any way or freezing type of energy in any way, so it does not damage the endometrial lining, but it will help tamponade the bleeding related to the uterus, in addition to kind of continuing our medical management. And so sometimes the tamponade will provide the same type of bleeding cessation that a pregnant woman has when they need a balloon in the setting of a postpartum hemorrhage. And so we just use a smaller balloon in an adolescent. Okay. So what should I do for heavy menstrual bleeding? Well, don't despair, first of all, and we don't want you to be embarrassed. So heavy menstrual bleeding can absolutely be treated, and so we want you to write down a little checklist, and this is what should be on your checklist. Talk to your parents about your heavy cycles. Talk to your primary care provider about your heavy cycles, and get a referral to see a pediatric hematologist and gynecologist. We want to make sure that you have access to resources and know about our webpage, the Young Women's Bleeding Disorder Clinic at Texas Children's Hospital.
Yes, in 2009, we started the collaboration between pediatric hematology and pediatric and adolescent gynecology here at Texas Children's Hospital, and that is when we started our first combined clinic, the Young Women's Bleeding Disorder Clinic, which serves as a one-stop where the patients and families can see both the hematologist and the gynecologist and get their heavy menstrual bleeding and bleeding disorders both addressed at the same time. In addition to physicians seeing the patients, we also have other supportive services such as education provided by the nursing staff, social worker will see the patient for their social needs, and also genetic counseling is provided through this clinic. So this clinic has proved to be a tremendous resource for patients experiencing heavy menstrual bleeding, and in fact we have grown, I think, from one clinic that we had per month in 2009 to now having 3 clinics. We have our contact numbers here, so we encourage patients with heavy menstrual bleeding to contact us, as well as to talk to your healthcare provider to get a referral to see the specialist here at the combined clinic for your heavy menstrual bleeding and to look for any underlying bleeding disorder.
Yeah. We do try to provide information to patients on our website, and so you can look at our Texas Children's blog site, Bleeding Disorders in Young Women 101, for instance, as well as other important updates that are really designed specifically for you. So we'd like to thank you for your time today, and hopefully you've learned a little bit about heavy menstrual bleeding and bleeding disorders in young girls.
Thank you.